Okay, so we're going to be talking about PCA pumps in here. So does anybody know what PCA stands for?
Patient-controlled analgesia.
Analgesia, yes. So typically these, the advantages of these are that the patient can control how much medication that they're getting. They get it when they want it, rather than the nurse having to go to the Pyxis and grab medications every hour or however often they need it. They get it more quickly. So what kind of patients do we typically start this with?
Cancer patients.
Cancer. Who else?
End of life.
End of life, not as much, especially if they're not really with it enough to control, but maybe in certain situations. And then surgeries are a big one, especially after like major abdominal surgery. Sometimes they'll talk with the patient before the surgery to just kind of say, we're going to go ahead and put you on a PCA right after surgery. And then sometimes they might start them on PRN medications after surgery and then realize that that's not really controlling their pain, and so they need to go up to the PCA. So what kind of patients would you not want to start a PCA with?
Ones that aren't really conscious.
Yes.
That don't have a good conscience.
Yes.
State of mind.
Yeah. Who else?
Patients at a high risk for like drug abuse or dependence.
Maybe not typically. Yeah.
This one is like more of a question, but do patients with COPD usually get them?
They could, yeah. So the biggest are patients that are not conscious, or patients that are not that are cognitively impaired and they're not able to understand that they need to push the button, because who is allowed to push the button?
Only the patient.
Only the patient. Our family members. Yeah.
Touch the button either, maybe like amputee.
Yeah, patients that are unable to. So yes, family members are not allowed to push the button, and nurses are not allowed to push the button. Why would you not want somebody else pushing the button for someone?
Because they can't decide the pain level for them if they want
Yeah.
it right then or not.
Mhm.
They may not want it.
Yeah.
There could be an
Sometimes
emotional.
it's for, for responsibility, because you don't want to, like sometimes patients, they might put overdose and they put it on you, or it's the nurse that did it, so it's basically
Yeah,
for them to do better.
Yeah, the biggest thing is that we don't want to be giving them more than what they need or more than what they can handle, because that only they can judge what they need, and we wouldn't want to be giving them a dose when it's not appropriate to give them that dose, and overdosing them on these opioids. So that's the biggest thing. Like with education, you want to make sure that family understands that they are not able to push the button for the patient. You can definitely help put the button and position it to where they can push it. If they're having a hard time holding on to it, you can put it in their hand, but they have to be the one to push it. So what are some things that you want to assess on these patients that are getting PCA?
Pain before and after.
Mm-hmm. Yeah.
Vitals, blood pressure.
Mm-hmm. What's an important vital sign that you would want to
Blood
assess?
pressure.
What else? Respirations are definitely big, because what do opioids, what can they do?
Slow down.
Yes. So that's a big thing with opioids. You want to be assessing respirations and respiratory status. So you definitely want to be monitoring respirations, SpO2 closely. And at what level would you kind of be concerned, like with their respirations, like at what number? Yeah, less than 10 to 12, you'd want to be stopping the PCA and calling the doctor and letting them know that their respirations are decreased. And what else do you want to be assessing?
I know, like in clinicals, they always say to do their blood pressure before giving the pain medication.
Mm-hmm.
So
Yeah,
that's what I've seen a lot.
because morphine can drop blood pressure, so that's definitely important. Some patients might not be able to tolerate high doses of morphine if their blood pressure is low. What else do you want to be assessing?
Do you want to assess like you said, cognitive impairments? Like what if it starts to happen while they're on the opioid?
Yeah, so what if they start to become confused or they're unable to understand what they're supposed to be doing? That's definitely, or level of consciousness, you want to make sure that it's going to be expected that they're going to get a little bit drowsy. That's expected with opioids, but if you're coming in there and having a really hard time waking them up, that's going to be concerning. So you'd want to monitor their neurological status as well. Yeah, and then just monitoring for effectiveness of the PCA. So one of the settings on there, you can go in and look at the history and see how many times they have pushed the button versus how many times medication's actually been delivered. And so if you're seeing that they're pushing the button way more than what they're actually getting delivered, that might, along with assessing pain, that might clue you into the fact that it's not adequately treating their pain, or that they maybe need to be re-educated on things. So yeah, you want to, those are the biggest things that you want to assess with that. So typically what the doctor will do is order the medication, they'll order the dose, the concentration, and then they'll order the settings on it, so how often the dose will get delivered. So let's just say it's 2 milligrams. They'll say they can get up to 6 milligrams in an hour. And so they can only push the button 3 times in an hour. If they push it any more than that, it's not gonna deliver anything. So that's what you would input those settings, how much and what the max dose is every hour, and then the interval between doses. So they wouldn't be able to push it 3 times and get 6 milligrams delivered right all at once. There's going to be an interval between when they can get the medication delivered. So those are all things that you would check on the order. So I can just quickly walk you through how you would set up the machine. You're obviously not going to be expected to know how to do this semester. You'll be doing IV medications next semester, but just kind of getting you exposed to this, because you may see patients in the hospital with these. So you get the key and the drug out of the Pyxis. So typically the medications will come in a syringe like this. So we're just going to say that this is morphine today. So you have your key and your syringe. You also want to have a second nurse to be there to witness that you actually put it into the machine and that you programmed it and that it's actually going to the patient. Why would we want to do that with this medication?
Because it's a different class, it's a narcotic.
Yeah, so it's a controlled substance, so we want to always have a second nurse confirming that we didn't just take the medication home with us. So you will unlock it and open it, and then you're going to slide that into there. You're going to twist this and then push it down, and then it'll clamp around the bottom of the syringe. And then you pull this out and twist it around, so then it'll hold the syringe in place. So once you have that set up, then you can close the door and turn the key to program. And so you see the door's locked, but you're now on program. And then once you're done programming, you would lock it. So you're going to hit channel select. And you guys can come closer. So you would select whatever type of syringe it is. So we're just going to do the BD Plastipac 30 mil. Some of them have 50 mil options. So we're going to go with morphine. And then this is for a post-surgical patient, so we're going to do acute pain. And this is the concentration, so 2 milligrams per 1 mil. And then you just confirm that that's what you selected. So now it's going to say you should be monitoring respiratory status and oxygen saturation. So you'd confirm that. and then attach SpO2 or end-tidal CO2 monitor, and then confirm. So then that's just again confirming the drug amount. Okay, and then confirm. So we're going to do PCA dose only. And then this is where whatever, based on the doctor's orders, is where you would input the dose, the lockout interval, which is how often they can get it, and then the max limit, an hour. So 7 milligrams in 1 hour. So whatever the doctor orders, you would change that based on that. So then you hit confirm, and then close and lock the door. So lock it, and then you can hit start. And then it's ready. So then the patient, when they push it, you see that it's saying delivering PCA dose. So then that shows you that it's working. And obviously there would be tubing that would be connected to that and connected to the patient. So then that's kind of how you program it. And then if you want to go to the history, we'll wait until this is finished. So complete. So you're going to hit channel select and then go to options. You can look at history. And so total demands 6, delivered 2. So that's where and then it shows you the amount in milligrams that have been delivered. So that's where you can see, oh, they've pushed it a bunch of times, but they've only had 2 delivered doses. So then you might ask them, do you feel like this is controlling your pain, or are you in pain still? So that's where you can assess that. And then anytime that you are, like, let's say your syringe ends and you have to do a new syringe, you again always want to have a second nurse that confirms that this syringe is empty, they've had all of the medication delivered to them. That way you're not taking half the syringe home, and you're protecting yourself as well, so nobody can accuse you of stealing anything. So anytime that you're wasting any of the medication or changing a syringe, or at shift change as well, some places may have you confirm how much has been delivered at shift change and clear the pump at shift change. So just be aware of that. So any questions so far on anything about the PCA? I think I covered everything.
No questions.
Okay. So we can go through the discussion question, the discussion board that you guys did yesterday, and just go over the questions and the answers.
Sorry.
Did you have a question?
No, I said
Oh,
yes, please.
Okay. Okay, so I'll go ahead and read through the scenario again. So Ellen Watson is a 65-year-old white woman who just had a colon resection for a cancerous tumor. The surgeon ordered a morphine PCA pump to control the pain. Mrs. Watson has severe arthritis in her hands and lower back. She is on a daily NSAID to control the pain related to the arthritis. Her daughter Marie is staying with her during the hospitalization because Mrs. Watson is a widow. Mrs. Watson has not had surgery before, so she is not sure what to expect. She is upset about the diagnosis of cancer. Lana Bridges is a student nurse assigned to care for Mrs. Watson. She is in her last clinical rotation and will be administering all medications with her instructor's supervision. So question 1, Lana goes in to meet Mrs. Watson, and Mrs. Watson is holding her abdomen and is restless. She is pale. Lana asks Mrs. Watson to rate her pain on a scale of 1 to 10, with 10 being the worst pain you could have. Mrs. Watson tells Lana that it is a 9. Lana checks the PCA pump and notices that Mrs. Watson has not been pushing the button for medication delivery. What should Lana do to alleviate the pain?
Is this a multiple choice? I forgot.
No, it's just a short answer.
I think one thing would be patient education to make sure that she knows how to properly use it,
Yes.
and like the dosage as well.
Yes, so that's the first thing that you would want to do is assess why she's not been pushing the button. So Yeah, it could be that. I mean, you could look to make sure that the machine is on and that it looks like it's functioning properly, and then, but then assess why the patient. So don't go in there and ask them, why aren't you pushing the button? But ask them, hey, I noticed that you haven't pushed the button in a while or at all. Is there a reason why you haven't been pushing it? Something like that, to where you're not accusing them of anything, but just trying to assess the situation. And a lot of times they may say, well, I forgot how to, or I didn't know, or that kind of thing. So, and then in that case you would re-educate, and so yeah. So education, and then also including the daughter in the teaching, because she's going to be helping, she's going to be there, she's going to be helping care for her mother, so she could also re-educate her mom.
Are you going to tell the daughter not to push it?
Yes, yes, you would always include that in your education, that no family can push the button. So question 2, Mrs. Watson tells Lana that she is worried about getting addicted to the morphine because she has heard that it can happen. How should Lana respond? A, don't worry, the cancer prevents you from becoming addicted. B, it's okay, because you have severe pain, the medication is necessary. There is little chance of addiction. C, that is a valid worry. I wouldn't want to become addicted. D, my cousin was addicted to painkillers when he had cancer.
I would be so worried.
It's okay, don't worry.
I would so like back and forth between B and C. 'Cause, like,
Yeah,
B, you don't want to like assume that like, you know what I mean, like, but you also don't want to put your opinion in it. I feel like.
yeah, so the answer is B.
It's okay.
Don't worry.
Yeah.
You're in
So
pain.
it's okay because you have severe pain, the medication is necessary. There's little chance of addiction. So when opioids are taken for pain and then weaned off as the pain diminishes, there is little chance of becoming physically addicted. I mean, especially in the hospital setting, they're not going to be on these pain medications for a long time. So there's a low chance of, yeah, that's a higher risk when you have chronic pain of becoming addicted. So, and yeah, opioid, I mean, we have an opioid crisis right now, so it's a hot topic, and a lot of people might have some misconceptions about that they could easily get addicted to it, and so it's important to educate on that yes, that's a valid concern, but you're not going to be on this for a very long time, so the chances of that happening are low, and we will be weaning you off of it. So, question 3, Lana is developing Mrs. Watson's care plan. She wants to add more interventions and not just deliver pain medication. What are some other nursing actions that would be helpful to Mrs. Watson? Select all that apply. So A, relaxation techniques, B, distractions such as music, C, cold or heat applications, and D, massage. Yes, all of the above. So it's definitely good to include other modes of pain relief, and that might even help her not to have to use the morphine as much, or whatever medication they're on. So that is good to include those. And then the last question, Lana is assigned to Mrs. Watson 2 days later. While she is in the room, Mrs. Watson tells Lana that she is afraid of the cancer because there is always so much pain associated with it. She asks Lana how they treat cancer pain. How should Lana respond to this question?
Not every cancer pain is treated the same because they're each different.
Mm-hmm.
And not
Yeah.
all people experience cancer pain.
Yeah.
either.
Mm-hmm.
Also, I don't know if you would include this or not, but the text page also mentioned that explaining that some pain associated with cancer is normal, like there is going to be some pain,
Yeah.
but there are like therapeutic ways to relieve that pain over 90%.
Yeah. Yeah, and that's good to kind of let them know that it's going to be expected that you might have some pain. Again, everybody's different, but I mean, be prepared that you might experience some. But we have so many different pain relieving techniques and medications. The doctor's going to find whatever medication works best for you. And I mean, most people are able to get their pain under control. So good job. All right, so with the rest of the time that you guys are in here, you can just mess with the machines, practice programming them. Also, you can practice just how you would educate the patient, or what kind of assessment questions you might ask them related to pain, and just if you have any other questions for me.